So first of all, DCIS is the very, very beginning of breast cancer. It's considered stage 0. It's typically diagnosed by mammogram and is a step before invasive cancer. Invasive cancer is the type of breast cancer that has the potential to spread in your body and shorten your life, where DCIS theoretically is a step always before that, so it should be curable. However, in women with DCIS who are treated with breast-conserving surgery, meaning a lumpectomy where the breast is preserved, the risk of recurrence is relatively high, and half of all recurrences are invasive recurrences. So we know from 4 different randomized trials that radiation will cut that risk in half, and we also know that drugs like tamoxifen can also cut the risk in half. Tamoxifen is an anti-estrogen pill. We also know that mastectomy is associated with a very low risk of ever having a recurrence, something on the order of 1%. But mastectomy, you lose your breast. So women are often faced with a choice of mastectomy or lumpectomy, and then with lumpectomy, doing nothing or doing radiation or doing endocrine therapy, meaning tamoxifen or those other drugs, or doing both, lumpectomy and radiation and endocrine therapy. And each of these, all of these, are associated with excellent survival, close to 100%, but they're associated with very different local recurrence rates. Yet nobody really wants a mastectomy, nobody really wants radiation, and nobody really wants to take a pill that has potential side effects. So every woman is weighing the pros and cons of each of these options, and yet nobody wants recurrence either. So we created this nomogram, which is a predictive model that helps a woman estimate her risk of recurrence for her particular situation and with and without each of these adjuvant therapies, meaning radiation and endocrine therapy. So hopefully it will help her, in conjunction with her clinician, to weigh the pros and cons and come up with the right decision for her.